Urinary and fecal incontinence are pelvic floor disorders. They result in involuntary loss of control of a bodily function, whether it is the normal voiding reflex for urine or the control of normal bowel movements. These are disabling conditions that are very common and are estimated, particularly with urinary incontinence, to affect anywhere between 15 and 30% of women who stay at home and upward of 50% of women who are in nursing homes. The elderly are particularly affected by both these problems, and it is a condition that is not often mentioned by the patients, even to their physicians, as there is a certain degree of shame associated with these conditions. There are many causes for both urinary and fecal incontinence. There's not one particular cause that's more important than the other. Childbirth has been attributed for incontinence, size of the baby delivered, the number of tears that result from the delivery, as well as any other pelvic floor surgery, whether it's gynecologic or otherwise. Menopause has been blamed for incontinence, and that is mostly because the pelvic floor in a woman is very richly innervated with estrogen receptors, and in the absence of estrogen, the tone of the pelvic floor weakens. Fecal incontinence doesn't have a much better explanation. Most of the fecal incontinence that is encountered in our practice results from obstetric injuries or from nerve damage that could have occurred from either spinal cord disorders or neurologic diseases. Urinary and fecal incontinence is a group of pelvic floor disorders that can be diagnosed in an office setting. If you complain of either one of these two problems to your primary physician or healthcare provider, evaluation will include a history of the problem, physical exam will include a neurologic and pelvic exam, and testing will include a group of tests that come under the heading of urodynamic evaluation that will help us pinpoint the cause of urinary incontinence. For fecal incontinence, we have a group of tests that try and identify whether the problem is in the muscle of the rectum and anus or whether it's a neurologic problem arising from any other neurologic or spinal disease that is resulting in this problem. Once we have completed the tests, all of which are done in an outpatient test setting, we will be then able to highlight and offer you a variety of treatment options. Urinary and fecal incontinence, which encompass a range of pelvic floor disorders that could include prolapse, are all evaluated in an office setting and have very effective treatments available for them. Most of the times, what we have experienced is that a very small number of women even mention that they have these problems to their physicians and hence do not take full advantage of what is available to them for evaluation and treatment. When it comes to urinary incontinence, once we have established the cause, there are very effective medical as well as surgical treatments, and if someone is very reluctant to go through any surgical treatment, effective pelvic floor physical therapy is also available that can alleviate the symptoms to a certain degree. With fecal incontinence, there have been several advances in the last few years that are now FDA approved with excellent results when it comes to neurologically mediated fecal incontinence. Even if the testing in the office does not identify any muscle weakness for the cause of incontinence of urine, and we do identify a muscle problem in the muscle of the bladder, we now have a pacemaker available that can be implanted that gives very good results to the tune of 70% improvement. The main message here is, unless and until you come forward with the symptoms, there are so many treatments available that can be availed of that today are here for you, but the first step has to come from you.